The physiology or function of the respiratory system blood supply. The lungs are pyramid-shaped paired organs that are connected to the trachea by the right and left bronchi. On the inferior surface, the lungs are bordered by the diaphragm. The lungs are enclosed by the pleura, which are attached to the mediastinum. The right lung is shorter or wider than the left lung, and the left lung occupies a smaller volume than the right. The cardiac notch allows space for the heart. The apex of the lung is the superior region, whereas the base of the opposite region near the diaphragm. The costal surface of the lung borders the ribs. The mediastinal surface faces the midline. Each lung is composed of smaller units called lobes. Fissures separate these lobes from one another. The right lung consists of 3 lobes, the superior, middle, and inferior lobes. The left lung consists of 2 lobes, the superior and inferior lobes. A pulmonary lobule is a subdivision formed as the bronchi branch into bronchioles. Each lobule receives its own large bronchiole that has multiple branches. An interlobular septum is a wall composed of connective tissue which separates lobules from one another. The major function of the lungs is to perform gas exchange, which requires blood from the pulmonary circulation. This blood supply contains deoxygenated blood and travels to the lungs where erythrocytes pick up oxygen to be transported to tissues through the body. The pulmonary artery carries deoxygenated arterial blood to the alveoli. The pulmonary artery branches multiple times as it follows the bronchi, and each branch becomes progressively smaller in diameter. One arteriole and an accompanying venule supply the drain one pulmonary lobule. As they near the alveoli, the pulmonary arteries become the pulmonary capillary network. The pulmonary capillary network consists of tiny vessels with very thin walls that lack smooth muscle fibers. The capillaries branch and follow the bronchioles and structure of the alveoli. It is at this point that the capillary wall meets the alveolar wall, creating the respiratory membrane. Once the blood is oxygenated, it drains from the alveoli by way of multiple pulmonary veins, which exit the lungs through the hilum. The nervous innervation. The blood supply of the lungs play an important role in gas exchange and serve as a transport system for gases throughout the body. Innervation by both the parasympathetic and sympathetic nervous systems provides an important level of control through dilation and constriction of the airway. The parasympathetic system causes bronchoconstriction. The sympathetic nervous system stimulates bronchodilation. Reflexes such as coughing and the ability of the lungs to regulate oxygen and carbon dioxide levels also result from autonomic nervous system control. Sensory nerve fibers arise from the vagus nerve and from the second to fifth thoracic ganglia. The pulmonary plexus is a region on the lung root formed by the entrance of the nerves at the hilum. The nerves then follow the bronchi in the lungs and branch to innervate muscle fibers, glands, and blood vessels. Pleura of the lungs. Each lung is enclosed within a cavity that is surrounded by the pleura. The pleura is a serous membrane that surrounds the lung. The right and left pleura, which enclose the right and left lungs respectively, are separated by the mediastinum. The pleura consist of 2 layers. The visceral pleura is the layer that is superficial to the lungs and extends into the lines and the lung fissures. The parietal pleura is the outer layer that connects to the thoracic wall, the mediastinum, and the diaphragm. The visceral and parietal pleura connect to each other at the hilum. The pleural cavity is the space between the visceral and parietal layers. The pleura perform two major functions. One, to produce pleural fluid that lubricates surfaces, reduces friction to prevent trauma during breathing, and creates surface tension that helps maintain the position of the lungs against the thoracic wall. This adhesive characteristic of the pleural fluid causes the lungs to enlarge when the thoracic wall expands during ventilation, allowing the lungs to fill with air. The pleura also create a division between major organs that prevents interference due to the movement of the organs while preventing the spread of infection. Pulmonary ventilation. The difference in pressures drives pulmonary ventilation because air flows down a pressure gradient. That is, air flows from an area of higher pressure to an area of lower pressure. Air flows into the lungs largely due to a difference in pressure. The atmospheric pressure is greater than intra-alveolar pressure, and intra-alveolar pressure is greater than intrapleural pressure. Air flows out of the lungs during expiration based on the same principle. Pressure within the lungs becomes greater than the atmospheric pressure. Pulmonary ventilation comprises two major steps: inspiration and expiration. Inspiration is a respiratory cycle, is one sequence of inspiration and expiration. Two muscle groups are used during normal inspiration: the diaphragm and the external intercostal muscles. Additional muscles can be used if a bigger breath is required. The diaphragm contracts, it moves inferiorly toward the abdominal cavity, creating a larger thoracic cavity and more space for the lungs. The external intercostal muscles contract and moves the ribs upward and outward, causing the rib cage to expand, which increases the volume of the thoracic cavity. Due to the adhesive force of the pleural fluid, the expansion of the thoracic cavity forces the lungs to stretch and expand as well. This increase in volume leads to a decrease in intra-alveolar pressure, creating a pressure lower than atmospheric pressure. As a result, a pressure gradient is created that drives air into the lungs. The process of normal expiration is passive, meaning that energy is not required to push air out of the lungs. The elasticity of the lung tissue causes the lung to recoil as the diaphragm and intercostal muscles relax following inspiration. The thoracic cavity and lungs decrease in volume, causing an increase in interpulmonary pressure. The interpulmonary pressure rises above atmospheric pressure, creating a pressure gradient that causes air to leave the lungs. There are different types or modes of breathing that require a slightly different process to allow inspiration and expiration. Quiet breathing, also known as eupnea, is a mode of breathing that occurs at rest and does not require the cognitive thought of the individual. During quiet breathing, the diaphragm and external intercostals must contract. Diaphragmatic breathing, also known as deep breathing, requires the diaphragm to contract. As the diaphragm relaxes, air passively leaves the lungs. Costal breathing, also known as shallow breath, requires contraction of the intercostal muscles. As the intercostal muscles relax, air passively leaves the lungs. Forced breathing, also known as hyperpnea, is a mode of breathing that can occur during exercise or actions that require the active manipulation of breathing, such as singing. During forced breathing, inspiration and expiration both occur due to muscle contractions. In addition to the contraction of the diaphragm and intercostal muscles, other accessory muscles must also contract. During forced inspiration, muscles of the neck contract and lift the thoracic wall, increasing lung volume. Forced expiration, accessory muscles of the abdomen contract, forcing abdominal organs upward against the diaphragm. This helps to push the diaphragm further into the thorax, pushing more air out. In addition, accessory muscles help to compress the rib cage, which also reduces the volume of the thoracic cavity.